Okay, I think we are here. Hi everyone, we're running a few minutes late, but we are here today with two special guests. And obviously I'm not Sylvia, as you can see. And you might have seen me last week if you were watching. My name is Maria. I'm a lecturer at the Department of Psychology, University of Essex. And I'm part of the Baby Lab and obviously part of From the Womb to the World, our WoW group, which is a multidisciplinary group that was born to try and provide science-based information about babies' development and make it more accessible to parents, with the aim of empowering them in their journey to parenthood. So with our group, we are trying to make science-based information as accessible as possible, trying to get people talking and share information that is accessible to all parents throughout their journey, and give them continuity from pregnancy to parenthood. And as I said, we're here with two special guests today. They're from Essex Mind, which provides access to a wide range of talking therapy treatments for adults with common mental health problems around Colchester and the Trending area. And we have Sarah Smith and Alina. And Sarah is a cognitive behavioral therapist, and she's been working in mental health for about 25 years or so.
Yeah.
And I believe they're with a special interest in perinatal mental health over the past 10 years. And Alina is an assistant psychologist and as well a strong interest in perinatal mental health work. And over the past 10 years has been working in mental health services as also a psychodynamic counselor. So today we're going to be talking about pregnancy during the antenatal, anxiety during the antenatal period, and we'll try and see how we can talk more about these mental health issues surrounding pregnancy, and especially how we can address the anxiety that many parents may feel during this time. So I'd like to start, if you don't mind, with a kind of like straightforward question, but that I believe is really necessary to ask. So what is antenatal anxiety?
Hi, Maria. Hello, everybody. So starting with just actually what is anxiety in general is probably quite a helpful place to start. Anxiety is a normal part of life, a very normal reaction. It's something that we all experience and is actually quite a healthy, necessary emotion to have. Obviously, in the current times, anxiety for many people, ourselves perhaps included, anxiety is quite high at the moment because there's so much uncertainty and difficult things happening in the world. So antenatal anxiety, very similar to anxiety. It's something that can occur during pregnancy. It's something that's very common. Estimates around 20% of the population of pregnant mums will experience anxiety at a level that is difficult, and it can affect people in a whole variety of different ways. It can range from just having a lot of worries about specific things such as the birth. It can be worrying about your health or health of the baby, worrying about the wider family, especially in these current times. But it can also be a kind of more just a general sense of feeling anxious all of the time, and just having a sense of just things are not okay. But it can be quite difficult to pinpoint what you're worrying about. So people can experience it in a variety of different ways. Does that make sense to you?
Absolutely. And I think it's so important to explain that although we do have labels that can help us to understand, okay, this is a common feeling that can be classified as anxiety, there are a variety of different ways in which people can actually feel anxious. And they might not necessarily fit within that specific box, but we can still do something about it. And it's very important to address those different shades, if you like. We know from some research, for example, that our collaborator Sylvia in Dr. Rigato here at Essex has done, that many of the women during pregnancy that experience some levels of, if you like, worries, they don't fit within the diagnosis of having a mental health issue, but they still have to process all these emotions, and those emotions have a consequence in the way they might deal with everyday life situations, their babies, their relationship, and they're not addressed because they don't fit within those strict categories. So I think it's really important to explain that there are a variety of different ways in which we can experience anxiety.
Yeah, absolutely. And, it's important also to notice that from a biological point of view, we are naturally going to feel more anxiety when we're pregnant. And that can have a protective factor. Our thoughts can be more threat focused. We can be more likely to pick up potential threats in the environment. And there is an evolutionary useful function to all of that. What can happen, as you say, is that kind of natural process can sometimes become excessive and can sometimes have a negative impact on our functioning and on our well-being. And as you say, it can then have an impact on the way in which we deal with that. So, for example, sometimes if we're feeling very anxious during pregnancy, we might feel like we can't talk about that because we're supposed to be happy. It's supposed to be like this wonderful time, and actually we're not feeling happy. We're feeling very worried, very preoccupied, might be feeling very uncertain about a lot of things. But because it's not talked about enough, we might find ourselves withdrawing from people and not expressing how we're feeling, or we might start to avoid doing things that we would enjoy or would probably make us feel better, because we don't feel we're not feeling as we should be feeling. So we're kind of wanting to almost hide that, even a sense of shame sometimes that we shouldn't be feeling the way we are. And this can make it much harder for us to deal with if we're also not doing the usual things that would help us, or not communicating how we're feeling.
Absolutely. There's a lot of pressure on women, especially, I guess, to have, as you said, these happiness and joyful time waiting for their babies to arrive. But it's an unknown situation that can cause a lot of stress. And the pressure on top of that is definitely going to empathize these anxiety triggering situations. It's really important that we talk about that. Absolutely, and try to sort of reduce the sense of feeling ashamed or feeling like you shouldn't feel that way, because there are so many reasons why we might feel that way. I can't imagine how tough it must be at the moment, dealing with pregnancy plus dealing with everything that's going on, the worries about health, finances, the pressure on relationships. It's a really difficult time anyway, isn't it? So I can only empathize how difficult that must be, managing all of those things. It can be really difficult in particular as well if people have got other factors that are contributing to the anxiety. So if for example we've suffered with anxiety or depression in the past, that can have an impact. Being pregnant in itself can cause sort of difficulties and tension in our relationships sometimes. It may be that somebody has
struggled for a long time to become pregnant, or perhaps they were uncertain about their feelings towards a pregnancy. There can be all sorts of factors that would contribute and add to that already natural process that's happening. And if we've had past histories of difficulties, that it can really bring things up when we become pregnant ourselves. Equally, it could be that there are no obvious things to cause the anxiety, and sometimes people feel, I shouldn't be anxious, everything's fine, I've got a job, I've got a nice family, how dare I be anxious? But there isn't always a clear reason, and that is equally valid as well. Anxiety is anxiety, and it is important as women and partners that we do talk about it if we're having difficulties. There is absolutely no shame in discussing this very natural, very common experience that many women and men will have during pregnancy.
Yeah, and I think you touched on 2 points, and I might just say them both because I got this baby brain now going on. So but one of them is fathers, right? We talk a lot about antenatal pregnancy, assuming that it's just about women, but we know it's not.
Absolutely.
It's becoming more and more apparent that partners, so in specific case, fathers, there's research that shows that they do experience antenatal mental health issues. And when we talk about pregnancy, we should talk about the family unit and address how these can be facilitated, how the relationship can be facilitated in terms of family. And the other aspect that I think also is critical is the approach that you in the facility you take as in terms of self-compassion, right? And we kind of like touched upon it without necessarily speaking or mentioning the label self-compassion, but is a critical part of just accepting that it's absolutely fine to go through these different emotions, and what is important is how we can address them and do something about it. So I don't know if you'd like to expand a little bit on these 2 different aspects.
Yeah, absolutely. So completely emphasize that point that you said, that when we talk about pregnancy and antenatal, postnatal depression, anxiety, this does very much include both mum and dad, and we do really recognize that this can happen to either partner during any stage of the process. So yes, the services now, which Alina will talk a little bit more about the practical side, how you access them. But we do prioritise people experiencing either antenatal or postnatal distress, whether that's mum, whether that's dad, because we recognise the impact that the distress can have both on the person experiencing it and, of course, the wider family and baby. So we really try to prioritise this client group so that we can help early and minimise the impact that's going to have. With regard to self-compassion, this is something in our service, and particularly working with mums and dads, we really, really emphasise the importance of trying to develop a more kind, more compassionate approach to ourselves, because actually what we're experiencing here, whether it's anxiety, low mood, depression, they are all normal human experiences. They're not a fault. They're not some kind of defect. They're a normal human experience to sometimes adverse or difficult situations. And if we're very self-critical about our emotions, we're not only experiencing the anxiety, we're also then on top of that experiencing, feeling guilty, feeling sad, feeling ashamed for what is a normal human experience. And that makes us so much less likely to actually reach out and ask for help. We're more likely to kind of want to close off and withdraw and hide it when there is no need to hide it. There is no shame in experiencing these normal human experiences. There's no shame in it at all. And the more kind and the more compassionate we can be to ourselves, although that can be a really long journey and a daily sort of challenge, even if we can work on that a little bit, that will help in terms of the symptoms we're experiencing, in terms of our ability to ask and also to take in help. If we're starting just a tiny bit to be a little bit more kinder to ourselves, cut ourselves a little bit of slack and accept, I think you said that word, accept our feelings rather than trying to fight or deny or hide them away. It's really, really important.
Absolutely. I think it's really spot on when we take this approach, self-compassion and just being kinder. Especially in a time in your life when you're going through so many changes, and regardless of whether it's your first pregnancy or you've had pregnancies before, is always a new experience. Your body is constantly changing and adapting, and keeping up with all these changes can be very difficult. And you might expect yourself to deal with those changes in a way, and then in reality, you might find yourself surprised by how difficult it is to keep up or deal with all these changes. So there's always a constant discrepancy between what you expect and the reality. And making sure that these two levels align, I think, is really important. And compassion is critical in that sense. Just accepting that things can go completely differently, and you might not be ready to cope with that or face those new challenges, but it's absolutely fine, and there are people that can help with that.
Yeah, absolutely. And I think you're right, because if you're more prepared to accept that you might feel different if it is a second pregnancy, you may feel completely different. Circumstances will be different. There's no kind of set pattern to how you're going to feel. Actually what also can happen is when people are more able to open up and express, I'm really struggling here, I don't know why, but I'm just feeling really anxious all the time. So often what will happen is the person they're speaking to will then feel more able to open up on how they're talking, and how they're feeling, rather. They will be able to talk about that. And, it's almost like once one person acknowledges it, then it enables other people. And quite often people will say, I never thought you'd be struggling. You seem so together. It's almost like this silent kind of conspiracy where we all act as mums like we're perfectly fine. And when somebody breaks that silence, then other people will come forward as well, more often than not, which is wonderful.
Yes, absolutely. And one of the things that I think it might be interesting for people to know in this regard is if someone is pregnant and dealing with these different emotions and anxious feelings, what can they expect from the service, from Health in Mind, in not necessarily just in practical terms, but what are the therapies that you provide? I'm aware that there's a focus on cognitive behavioral therapy, and some people might not necessarily know what that is about. Would you like to explain a little bit and give us a little bit of more information about that?
Yeah, sure. And actually, cognitive behavior therapy is a wonderful therapy for a lot of people, but it's not for everybody as well. And sometimes people will have had a not positive experience of that type of therapy, or they'll have someone else has told them. So we offer a range of different therapies, cognitive behavior therapy being one of them. But what they could expect would be, first of all, an assessment, and it will usually be by a therapist or a wellbeing practitioner who is experienced in perinatal mental health. So the assessment will be quite tailored to that experience. You can definitely expect a non-judgmental, warm and encouraging response from the person you're speaking to. And the assessment is a brief assessment, but it is also quite thorough. So it will look at a whole range of things in terms of, the past history of the problem, and what kind of things were leading up to you feeling this way, looking at the symptoms, looking at the possible options that might be helpful to you. And then usually what will happen is the person either on that phone call will make some suggestions for treatment, or they may take a second opinion and come back to the person who's being assessed. But ultimately what will happen is that you'll be offered usually one or two options for treatment that will hopefully be tailored to your particular needs, if treatment is necessary or desired. Or it may be sometimes people are just looking for some practical support or don't really know what they need. And usually the assessment will provide some clarity on that and some clearer way forward. And that might be something our service offers, or it might be something different from that, but we should be able to advise.
That's brilliant. And do you, I suppose there's been some adjustments during this time, obviously with face-to-face meetings not being possible. Can people expect the same level of support online, for example? And
yeah, so there has been actually, yeah, we didn't talk about the type of therapies. Cognitive therapy is one, cognitive behavior therapy, or it might be counselling for depression. There's a whole range of treatments. At the moment, we're not seeing people face to face. Obviously, that will change according to the latest government guidelines. We're adapting and changing, day by day, really. But people are being offered other options, such as telephone work, online work. Sometimes it can be through live messaging. Other times it can be face-to-face through something like Zoom. There's group work. And I think Alina is going to talk a little bit more about how the process would go and the range of therapies we offer.
Yeah, it would be great. Yeah, Alina, if you have any insight as we are into the topic, to give us more information about that.
Yeah, sure. First of all, hi everyone. So what Sarah was talking about is that is the first step is to kind of acknowledge there's something that's not really working well for you, and then get in touch with us, which can be straightforward. You can just log in on our website and fill in an online referral or give us a call. It can also be done through your GP. Health visitors sometimes can help with this as well. So once you contact us, in 48 hours, we call you back for an initial assessment, which is about half an hour, 45 minutes, very informal, a discussion to see where you are. And as Sarah has already said, based on that, we will be looking at what type of support you can access if you'd like that. Sometimes it's therapy, sometimes it's just practical issues that we are also able to help. We get to do this with Mind charity, North East and Mid Essex Mind. They offer the STAR service, which is all about practical things like going out, applying for benefits in some cases, helping with work, anything that might impact how you feel as well. And sometimes it's that and therapy, sometimes it's just therapy. And to kind of go back to the question about what people would be offered, based on their needs and their preference as well, in that discussion with the assessor, they would be offered different options. Some of them are individual work, which is very often the case, and that can be done over the phone. Sometimes it's done face-to-face, as well as group work. And we have quite a few groups that are happening on a regular basis. They're small groups. They take they happen every week for about 6-8 weeks usually. They're conducted by 2 of our therapists, and people there learn a lot about themselves, about the issues they're struggling with. We have some for postnatal depression, our open arm groups, and some for traumatic births, and we're also looking at setting some new ones. One of them is for that, actually, as we're seeing an increase in this service, but it's still very much in the planning stage. and also neonatal loss, because sometimes that is also part of our work. So yeah, based on that discussion, people are offered these options, as well as online, as Sarah mentioned. This is becoming more popular as well, because when you have a child, or you're waiting for a child, probably might be a problem in itself. So some moms and dads prefer that option. And yeah, I suppose a very good point to keep in mind is that perinatal work is prioritized in our service. So while there is a waiting list, unfortunately, it's the way with many NHS services, the perinatal pathway is very quick. So we are aiming at providing therapy in 2 weeks for parents or parents-to-be who are struggling with mental health issues. So it's quite quick. And once you are in the service, what you need can be addressed, and sometimes people decide something doesn't work for them and they're offered another type of treatment. It's all very flexible and it's very client-centered, and as Sarah has said, it's not only CBT that we offer, and we work with many partners in the area as well. So we have quite a holistic approach to mental health, and we are aware that helping parents actually makes a major difference in the life of the child they're gonna have, and the extended family, as you said, Maria, a bit earlier. So yeah, I think that would be the process really. And once you would like to access this, all you have to do is give us a call or fill in a referral. I'm happy to give you the details if you want to share them with your audience, the link as well as the number.
Absolutely, yeah, it would be great if we can add those links on the live stream.
Okay. I'll do that. And of course, if people have questions, I'm here to address any kind of questions about how to refer into the service.
Thank you. I'm going through some of the comments to see if there's any question. And I know we received a question earlier that I can ask directly now, so we can just get into the mood of questions. But this one, so I think we actually talked about the kind of support that people can expect to receive from the service, and it's wonderful to see how quickly people can actually reach out and get a response, and the variety of help that can be offered. And I think it's so important to emphasize that, as we know that there's no one way of feeling anxious, there's no one way of dealing with that anxiety. And for different people, we might need different approaches. And even for the same person, there might be differences in the way they can cope, depending on contextual factors, life events, and so on. So whatever worked for me 5 years ago might not work again now. And it's really important to have this client-based approach, as you mentioned, and just focus on the person in front of you. And I think that's really, really important to emphasize. So thank you for mentioning that again. And we have another question that is specific to grief, and the person asking what kind of advice can you give on supporting a grieving partner during pregnancy, and how to approach grief during pregnancy.
Yeah, and we're thinking this is Dad who's grieving from the question?
Yes.
Yeah. So again, everybody will experience bereavement and grief differently. So there is no straightforward answer to what will help. But what we could say really is, if somebody is in the process of grieving during the pregnancy, whether that's mum or dad, and that process is affecting them very strongly. So it may be that their emotions feel overwhelming, or it may be that they feel perhaps cut off from their emotions. For whatever reason, they may feel that they're really struggling. This could potentially have an impact on their ability to engage with the pregnancy. On an emotional level, it may make that harder for them, which of course, you know, is it's not helpful. So I would recommend initially for them to perhaps, if the usual things, talking to friends and family and seeking help and expressing feelings is not enough, I would recommend that they contact our service, and we could provide an assessment to find out how this is affecting them specifically, and what kind of help or treatment may help them facilitate this. It's a natural process. Grief is a natural process, but for some reason, for some situations, that natural process can get blocked or be prolonged or more difficult to manage, and in that case it's really important to get help, and to establish what kind of help would be best for them. And again, as Alina was saying, you know, if you're pregnant or your partner is pregnant, you will be prioritized for that treatment through our service and from many other services as well. So I would recommend they get in touch.
Absolutely. Yeah, it's really good advice, and it's just again important to remember that it's absolutely normal to go through some feelings like that and emotions, and especially in a time when we're more vulnerable, it might be even more difficult to support someone close to you. And we have to have that self-compassion, just accept that we might not be in the best place to help or give that strength as we would like.
Yes, it can be particularly difficult if both partners are grieving, if they're both going through that process together. Sometimes it brings you closer together, but other times it can feel like you're not able to support one another because you're going through your own process and you don't have the energy or the strength to support the other person, and that is completely normal and understandable, and definitely a time to reach out and get support.
Brilliant. Well, I'd like to thank you both for the time that you've given us to talk about this very important topic, and especially during these times when we might all feel a little bit more on the edge. And it's really wonderful to hear the service that you provide in the area, and it's such a relief to know that, you know, we can reach out and be helped. And I think people would have enjoyed hearing more about this and just making the whole topic a little bit more accessible for everybody. And I'm looking forward. I know that you're planning to come back for another session that specifically focuses on postnatal time, and I'm really looking forward to that. Hopefully by then I will have my own baby as well, so great timing.
Oh, good luck with that, Maria. I hope everything goes smoothly.
Thank you. And again, if there's any other questions, I would advise people to just post them or let us know, and we'll be happy, I'm sure, to answer them offline as well. If okay.
I can see that someone has asked about how do they know if they need help or if we'll go away.
Yes, that's a really good question. Thank you for spotting that. So how do we know if we need help, or it's just something that it's there temporarily?
I would say if the things that you would normally do to help you cope don't seem to be working, or if you feel your emotions are it's not the normal level of sort of anxiety that you'd experience, but you feel it's really extreme, or it's having an impact on your ability to carry out some normal day-to-day activities, or you're withdrawing, or you don't want to go out, and it's really having an impact on you, I would probably say err on the side of caution and do ask for help, because it might be through an assessment that you establish whether or not you do actually need help, or whether just some self-help will, some guidance would be enough from the assessment. But if you're unsure, then I would say ask for help, because it's probably better to get the help while the anxiety is more manageable, rather than waiting for it to become extreme.
Absolutely.
Yeah, would you say anything more, Alina, there?
No, I completely agree with you. In a way, it's sort of better be safe than sorry, and we're happy sometimes, as you said, Sarah, that just having that one chat with someone for half an hour and reassuring you that it's normal to feel the way you feel, and maybe get some tips on how to manage those feelings when they're a bit too intense, can be enough for someone, just taking things off your chest. But sometimes it's a bit more than that, and that's okay as well. And there are options that you will find out about. And yeah, it's better to make that call rather than wait for things to get so complicated to kind of give yourself permission to make that call.
Yeah.
It's absolutely true. It's always better to be on the safe side, especially when we are so vulnerable, as we said, during pregnancy or postnatal time. It's important to have that extra support if we feel that we might be struggling. And I think, again, it's all about accepting and being kind with ourselves, and making sure that we know that there are services available and we can actually ask for help.
Yeah, and you won't be judged for that.
Well, that's a great note to conclude on. And again, thank you so much. I'm going to check again just to make sure I'm not missing any more questions. But it's, again, we're very thankful for having you here, and we're looking forward to session number 2.
Thank you very much. Our pleasure.
Yeah, thank you, Maria.
Thank you very much.
Thank you. Take care, everyone. Bye-bye.
Bye.
Bye-bye.
Bye.